Hello, John. We're going to talk about drugs and the drug issues facing Ireland at the moment. There's a lot of news about drugs and drug addicts in the news. There's talk about it being treated as a health matter as opposed to a justice matter. So, do you agree with that?
No, not whatsoever. The medical profession, doctors that are concerned with this misuse of drugs, especially cannabis and those drugs, have come out. There was a program just happened here in the last couple of days about the consultant in Cork University Hospital. He was on the High Noon program, which is run by George, which George who presents on News Talk, and he was scathing about this effort by the political nincompoops to bring in this business of legalising the use of drugs for personal use. It is a recipe for disaster because it does cause problems to people that use these drugs and perhaps misuse them. It's all very well, there may be an odd individual that use of these type of drugs, it does not adversely affect. But any sane person knows that if you overindulge in alcohol, for example, or anything, you pay the price. So it is symptomatic of a government that panders to what they perceive the media support or the media agenda is in this area.
Okay, Leo Varadkar says he's determined to bring about the Public Health Act by the end of the year. What do you think of that?
Well, Leo Varadkar,
the Public Health Alcohol Act. Sorry, I meant to say.
Right, Leo Varadkar is now the Taoiseach and Prime Minister of this country. He's a relatively newcomer to the Dáil, but Fine Gael has chosen to pick him as the Taoiseach with the support of Fianna Fáil and some independents. His record prior to being Taoiseach, there's nothing that I know about his record that would inspire confidence. In the business of the drugs or the alcohol act, the fact is there's enough laws surrounding alcohol and having a drink as to nearly make it impossible for one to have a social drink or two in their local pub throughout the country.
Yeah, but he's talking about laws to help addiction. He's not talking about the social drinker, he's talking about the problem drinker or the problem drug user.
Well, you see, the laws are there to make it, that the laws should be there to make it with regard to drugs. Alcohol, there's enough rules and regulations pertaining to it.
So are you saying that the alcohol use should be a matter for the individual rather than introduce more laws?
Precisely, because the alcohol has been around nearly since the dawn of civilization. People now are more aware of it. People that produce alcohol products have a warning on their labels: drink sensibly and be aware. So there's enough evidence and enough regulations surrounding the use of alcohol that it should be enforced rather than bringing in more. But there's one particular area as regards alcohol that they appear to be incapable of legislation for, and that is the sale of alcohol in supermarkets and other places of that calibre where they're much lower in price than what obtains in the pub. So that's where the problem lies, if you like, and
We can come back to that in a second, John. I just want to go through a few things here. So, how dangerous do you think soft drugs? You've heard the term soft drugs. Do you think soft drugs are dangerous? Do they cause problems? Should they be legalized, such as cannabis, for personal use?
Not whatsoever, because you legalise cannabis or some other what they call soft drug. There is no such thing as a soft drug that's used for this for the purpose of this discussion. To sort of encourage and allow people for their personal use to use these mind-changing drugs is a recipe for disaster. It is symptomatic of this government. Instead of creating jobs and reviving towns and villages that had been neglected and practically deserted under this government and previous governments, tinkering around with something that the media promote, but nobody else, no medical person promotes this nonsense.
So, what do you think? I mean, for example, Luke Ming Flanagan, who's now an MEP, he has in the past promoted the legalisation of cannabis, but since he became a family man, he's renounced that. So his platform really was all along, it had been probably for election purposes. He wanted to appeal to the younger audience. He wanted the legalisation of cannabis.
Yeah.
He no longer supports that. Okay, what do you think of a politician that promotes the legalisation of drugs for personal use?
Well,
is it reckless?
It's Leo Flanagan. Now he had uncles in the priesthood that were of great credit to the Catholic faith and to the parishioners that are represented. I spoke about one in Sligo before, in 100 and odd years ago, that less even, that helped Irish Catholics to be able to cut their turf when they wanted to give it to somebody else. Now, Luke Ming Flanagan, this Ming part is a kind of a nonsensical addendum to his name. I don't believe he was christened that. He did give the impression that he had long since ceased to practice his Catholic faith, assuming he was baptized, which I have no doubt he was. So he's changed his mind since a family man, but we don't. That's the first I heard of that. That information is not sort of portrayed by the media to sort of say that he has changed his mind. Now he doesn't support this. So the people that are supporting it perhaps don't use drugs. So it's easy for them to sort of pander to this, not that I'm aware of, this demand for the use of what they call soft drugs. There's no such thing as a soft drug, bar it's medically prescribed, and they're drugs to improve your health. But drugs that change your behaviour and change your mind, they are an abhorrent. Wherever it's been tried in other countries, it's turned out to be a disaster, not least in Holland, and I believe in Portugal. They tried this road and it's having disastrous results, but not enough evidence to support it. I mean, if you want to take drugs and wait to see whether you start behaving abnormally and maybe like a schizophrenic or something, this is the result. Doctors have seen the sad effects of this drug abuse in their hospitals every weekend. The people are out of their mind. It also accounts for the antisocial behaviour that you see and the robberies that you come across that doesn't make sense, and the treatment of older people by these robbers is absolutely scandalous. All I believe to do with drugs, soft drugs or whatever this nonsensical government talks about. Leo
Varadkar is probably not much of a drinker, and he's probably not a drug user, and probably never has taken cannabis. I don't know, but I would assume he hasn't. Do you think he's legislating in a kind of a populist kind of way? He's appealing, pandering to the public, or is he doing it out of ignorance?
Well, he's a doctor, so he should know better. As a matter of fact, that's one how do I call it? That's one platform or objective that they want to bring in, that should no more be thought of. There's more important things to be doing than legalising drugs for to destroy the young people. Young people at the moment, one can see, unless one is blind, that they do not appear to respect authority or respect even sometimes their parents, etc. I mean, how further more do you want to drive them astray? They should be promoting proper living and proper respect for yourself and your fellow man, and various other initiatives. For example, that kind of chronology, instead of looking after perhaps their older neighbours. I've come across people, not recently I come across an oldish woman, she must have been touching 90, and she was in the medical consultant room that I happened to be in, and she was chatty and I was talking to her, and she lived a few miles out the road in the town I was living in, and I said to her, how did you get in? And she mentioned a well-known Hackney man that I know. And I said, oh, that's good, he's good, and then collect you in. And how will you get home? Oh, he'll bring me home also. And I just thought, has she no neighbour? She's lived in the place all her life, a friendly, chatty woman who buried some of her children already because she lived to such a good age. Now, that's the kind of thing that should be promoted, to do something for older people that maybe can't do it for themselves. Sometimes have to pay somebody to do something. Okay,
John. I just want to go back to alcohol just very quickly because we're running out of time. Do you think that places that sell alcohol cheap, I mean, with the decline of the rural pub and the small pub, you see an increase in alcoholism now in Ireland because of the cheap beer that's been sold in supermarkets and off license. So would you agree that places that sell alcohol cheap should be hit with a higher tax rate and lower the tax rates for the pubs to increase responsible drinking?
I have a very simple solution to it. It doesn't require any of that nonsense. They shouldn't be allowed to sell it in the first place. An off licence would want to be very much vetted, which they are. But supermarkets, with the power that they apparently have with the political establishment, they should not be allowed to sell alcohol under any circumstances. That's number one. Off licences should be very carefully monitored so as they don't take the easy way out and supply alcohol to vulnerable people. The prices should be such that would reflect that wouldn't be that easy to be bought as cheaply. The tragedy is in this country that drink is much cheaper on the continent without the social consequences, the anti-social consequences that happen in this country. So there's obviously an education and a television agenda needed to try and put a bit of sense into them for them to...
So education.
Educate them and not let them have this soft drugs and other nonsense that this ridiculous government comes out with.
Thank you very much, John Malone.
Thank you.